Well, I am very honored and humbled to be here with Dr. Stuart McGill, who is someone I've followed work for a long time. And I think I first want to say, probably from myself and everyone else here, thank you so much for all of you've done in your work to help us. So how are you doing this morning?
Well, first of all, thanks you for that, Dave. And I am fabulous. I'm into my 60s now, and I have no pain. I did when I was 30, 40, and early 50s, but I feel fabulous now. So there's light at the end of the tunnel.
Yeah, that's great. That's great. Well, I value your time a lot, and I have some questions that we've kind of chatted about. And like I said, I've followed your work for a long time from graduate school, and I work a lot in a couple domains. So gymnastics is obviously a big one that I work with, but we also work with a lot of high-level Olympic weightlifters and CrossFit athletes. So I've understood the flexion-based pathologies that you've talked about pretty extensively, but I've always been very curious to hear some of your thoughts on the other side of the spine, so to speak, which is the extension and the compression-based issues. And after listening to a couple podcasts with Aaron, I got an introduction for you because I'd like to maybe pick your brain. I don't know how much you've done podcasting or talked a lot about the extension and compression-based injuries, but I just finished your recent book also, which has got a lot of compression-based stuff. So if you're okay with it, I'd like to kind of talk more on that side.
Yes, well, for people who have the video feed, flexion is bending the spine forward, and extension, now we're at neutral, and extension is going into a chest-raising extended position. The body migrates stress from one tissue to another by changing posture. So this is a really important issue. I'll also say, by way of preliminary, that we follow up with every patient I ever saw in the clinic at the university for my entire career there. And since I've retired, I still see athletes here at BackFit Pro, which is in my home.
Yes.
And we follow up with every athlete as well. So we know who comes in flexion intolerant or triggered by extension, or perhaps they're triggered by both. And one thing I was really surprised about when we followed up with patients, I am actually more successful with the extension intolerant athlete.
Interesting.
Which, yeah, that was a surprise to me. But one other thing, as a little bit of a background information, pain or intolerance to whether it's flexion or extension is caused by the applied load exceeding a tipping point. So if you're under the tipping point, it's healthful. It builds the tissues. When you cross the tipping point, it causes disorders or pain. Now that load, it can be a magnitude of load, it can be the rate that the load is applied, it can be the duration that the load is there, it can be the repetition of the load, and of course all of this is mitigated by risk. So you see, there's a lot of moving variables now as to why one person might become intolerant to extension and the next might not. And then the training side of it. Training causes load, which is a mechanostimulation. Mechanostimulation causes anabolic processes in tissues and builds them and makes them stronger and more robust and remodels bone and collagen and all these things. Or it can accumulate trauma if there's not enough rest periods. And we're going to talk a little bit about that, particularly when it comes to the younger athlete. So I had to get through that background to set the stage.
No, I'm all about it.
Yeah, well, gymnasts form a really interesting subset of athletes because, first of all, look at what's required of a gymnast. They need supreme spine mobility to compete well. Well, isn't it interesting that we're not all born equal? As the spine twists, the twist end range is defined by the facet joints. So posterior, they collide. Well, if the facet, you can see how the facet joints have an angle to them, like this. Gymnasts and someone who has a lot of mobility have open facet joints, which allows them to twist.
Interesting.
So if you're a stiff-spined person, you will not choose to be a golfer or a gymnast, but you could certainly play middle linebacker in the NFL. Now, here's the interesting rub. Let's just take my spine and say I have facets that are orientated this way. I can rotate and spin, no problem, but let's go into extension. Those facet joints are like shingles on a roof. As I go into extension, do you see how they collide and limit extension motion now?
Yep.
Well, as they collide, they are attached to the vertebra through the pars interarticularis and the neural arch behind. As you go into extension, that creates a bending stress on the pars. And as you know, what's the number one extension fatigue injury in a gymnast? It's a stress fracture of the pars. So isn't it interesting that the anatomy that was the gift to twist and be mobile puts more stress on the pars as you go into extension. Now let's compare that to a facet angle that's orientated more like this. So now when those two facets are stressed in extension, you see they just glide past one another. There's no bending stress on the bone. So those are closed facets, as you see there. And as you can see, if I extend and flex, do you see how those joints are just gliding past one another? So it's stress of the capsule. Whereas there's an open facet. Now when I go into extension, do you see how there, first of all, there isn't much, but the bone now stresses. So isn't it interesting? And we see this in almost every sport, that the anatomy that allows you to be good at a sport can also influence the pattern of stress concentration. And that's why every sport has a cluster of specific injuries. You know, who gets spondylolisthesis? The first thing that comes to mind are the dancers and the gymnasts. And there's a reason for it, obviously. So spondylolisthesis is a stress fracture, and I've shown you the mechanism. That bone bends as you go into extension. Every time you go into extension, the bone bends. A limited number of bends will build the bone. Now, I'll just talk about bone adaptation. And stop me if I talk too much, but this is very important stuff on how a young gymnast remodels and becomes stronger rather than injured. Let's take my arm as an example, a long bone. I'm going to bend it. This surface goes into tension, and this surface goes into compression. Well, everyone is familiar with bone remodels to stress, but they're probably not familiar with the details of the mechanostimulation. If you take two quartz rocks, two quartz crystals, and it's dark, it's at night, and you rub them hard together like that, you'll see a flash of lightning go through the rock. That's because quartz is a crystal, and in fact, it's called a piezoelectric crystal. It builds a charge when you stress the crystalline structure. Bone is piezoelectric. So now we can go back to the bone bending example. When I bend the bone, the region of the highest stress creates the highest piezoelectric charge, an electric charge. Now, in the blood and the plasma are free ions of calcium and magnesium, the building blocks of bone. They get chemically attracted to the piezoelectric charge, and they get scaffolded on. Well, here's the next bit. Bodybuilders train not to become strong while they're training, but simply to stimulate adaptation. And now the muscle grows the day after while they're resting. Bone takes much longer, 4 or 5 days, because if you just take one day off and then you bend the bone again, it breaks off those ions that have just attached. In other words, they're not scaffolded sufficient to bear a load. It's a much longer turnover. Now, believe it or not, all of this was discovered years ago on bending birds' wings and things like that in basic biomechanics studies, but the same principles hold true. So you have to do animal studies to learn these things. Yeah. And then, of course, you calibrate it. So that's the process. And there's quite a bit of wisdom there on why it's pretty good idea to deload and take a few days off every now and then if you want to prevent a stress crack from accumulating. And then conversely, you would callus over that stress crack, taking off a few days. It's fabulous. So there's a little bit of thought on that. And finally, to really answer your question more completely, there's more extension-driven pathology with gymnasts, and one is called kissing spines. Well, do you see the space between the posterior spines? So right. that person is very gifted to go into extension. So as I go into extension, do you see how they come together? But there's a kissing spine here and here. What will happen is on MRI, you will see bone edema occurring where the two come together and kiss. Now, bone edema is a bone bruise, right. And that will hurt. And there's also the interspinous ligament between each joint as well, and that can get crushed and damaged. So there's a little bit of a spectrum of what can go on in extension, but an assessment will, a precise assessment, a thorough assessment will help us hone in on what the mechanism is, and that will guide precisely what we need to do in terms of training modifications, time schedules, and that kind of thing. But fabulous question. I don't get asked that one very often.
Oh man, I just, my brain was turning over pretty quick to try to keep up with you, but that's super interesting because I've obviously seen a lot of those differences that you kind of highlighted, maybe the kissing spine, how someone's midline tender versus the lateral aspects are a little bit more tender. And it's interesting because if you do a really in-depth assessment, and again, I've been lucky to learn from your books, but a heel drop test versus a more of a PA shearing test might elicit a much different response. And someone will almost tell you like, oh, it doesn't really hurt when I back bend too far, it hurts when I land, which is kind of where I guess a few of my other questions are related to. But it does make sense that if you just do a detailed assessment and listen to the person, that you can kind of tease out those differences.
Absolutely. I teach a course, a master level assessment course is 2 days. And we just go through how you really provoke a spine, manipulating different combinations of posture, load, and that could be in shear, it could be in tension, it could be in bending, it could be in compression. And then we stress very specifically different tissues, and we see what creates the pain. And then we can now interpret what we see on the medical image, because some people will say, oh, well, the MRI doesn't correspond to pain. Well, that's because they haven't seen the person, so they don't know how to interpret which features are linked to pain, and the radiologist never sees the person. Such a my view, a flaw of medical practice, but that's another issue. Yeah. That's medical politics.
Yeah. So this, I guess the next one is going to be half question and half my brain trying to synthesize what you said in the first time. So I find that again, with that assessment, you can sometimes tease out whether someone is maybe compression intolerant versus just end range hyperextension. Like you said, you have an athlete who's extremely lax and has, more spine extension than they know what to do with. And it seems like the end range is what really provokes their symptoms. But especially as I've found, I work with a lot of Division I college or elite athletes, and it seems that they're more compression intolerant. So they land in a very high force, which is very, up to 15 times body weight in landing forces in floor exercise and dismounts. And I find that sometimes it's more of a compression in extension that provokes their pain than it is truly just hyperextended Stork test or a press up test. Can you speak to maybe the difference of those two mechanisms and why, you might need to look at two different areas of testing?
I'm going to start by complimenting you on not only your scientific knowledge, but obviously your experience, because only someone with robust background in both of those could ask such a great question.
Oh, thank you.
Fabulous. Well, I'll just repeat what I said in the last answer. A precise assessment will always reveal the cause. So let me go to a compression type of injury now. And generally speaking, usually it's damage to the end plate, the top and bottom of the vertebra. It's not a disc bulge yet. It's usually end plate damage. Well, all of these models, they're made by a company called dynamicdiscdesigns.com. I've got no business relationship with them, but all I can say is they're very biofidelic. They are modeled after our 30 years of creating these injuries in the laboratory. So this is actually, my last book I wrote is called Gift of Injury. It was written with the powerlifter Brian Carroll. This is one of the injuries he sustained. Now, the nucleus, the gel inside the bottom vertebra, has been dyed blue. So I'm going to pull the plug out so we can now go and look inside his vertebra. Now watch, I'm going to squeeze his spine in compression, and you see the blue nucleus coming up through a fracture in the vertebral body. So that has now caused a loss of height as we squeeze in compression.
Right.
So there's an example. Now, once we fracture an end plate and the disc no longer is able to contain pressure, micro movements occur. So consider your car tire. When you let a little bit of air out of your car tire, it bulges, the tire, and it becomes sloppy on the road. It doesn't control movement anymore. Your spine is exactly the same. So in this model, this top disc has normal stiffness, it's undamaged. The bottom one has normal stiffness, undamaged. Now an MRI doesn't show stiffness, nor does it show movement. But this middle one has had the fracture that I just showed you from too much compression. Watch, I'm now going to twist. You see how the majority of the motion now occurs at the joint that's lost its controlling stiffness. And the only way to detect that is through our instability tests in different modes, frontal plane and sagittal plane instability tests that we perform. But we can also see it with video fluoroscopy, as we've shown many times, even ultrasound. If you know what to look for, you will see the joint, and then you match the pain profile and those nerve roots, etc., and put the story together and confirm it. So there's a little bit of a cascade. We started out with a compression injury, which cascaded into micro movements now. So those get triggered. You say when you land. Well, when you land, you create a little acceleration shock. And it may cause compression intolerance. Well, you can get that statically or in landing. Or I'm just going to stand up now and I'll do a heel drop test. I'll just go up on my toes and bounce on my heels. Boom. Let's say that triggered pain. But now we'll determine whether it's micro movement or it's compression. I'm then going to say to the athlete, I'm going to push my fingers laterally into their oblique muscles. And I'm going to say, push my fingers out. Bang. Do you see what I did? Push them out. I have now created stiffness. That stiffness added compression, but they also added controlling stability. So now I'll say, now repeat the heel drop. Boom, and they'll say, oh, my pain is gone. So we've just proved that we added more compression and the pain went away, but we added more controlling stiffness. So the chance now is that that was a micro movement. We locked it up. And now we get into the transference to the gymnasium. Now that athlete will need new engrams if they don't have them to control the stiffness. So now I get into, is there clinical evidence for this? I wish I used to be very conversant with all these papers and I've forgotten them. I think it was one of the northern states, either University of Minnesota or University of Wisconsin. They started doing what they call them the McGill Big Three, but you know the exercises, curl up. And what they do is they add stiffness to the person's torso or core. I hate the word core stiffness, but nonetheless, everyone knows what I'm talking about. And when you do those three exercises, you add a neural stiffness Sometimes it lasts 20 minutes. It can last up to an hour or so in some athletes. So the brain remembers that stiffness, holds the joint. So with those people, start every training session with the big three, and it adds a controlling stiffness, engineers out the micro movements. And for that reported paper, either Wisconsin or Minnesota, wherever it was, they never had a back injury. Do you know the paper I'm talking about? That following. Yeah, that following year. I'd have to look it up in one of my textbooks. So there are some thoughts on all of that.
Yeah. I mean, it's very helpful, especially to contextualize what's going on from the, like you said, the pathology can definitely map to what they say, but also from a biomechanical model, you can see the differences there in forces, right? Because the gymnastics is unique, as many sports are, that it's not only one force. There's a variety of forces that the body encounters, and you have to really understand someone's story to kind of follow the right path.
Yes. People want, I've got back pain. Can you give me an exercise? And I say, well, there are 1 million people on the internet who will give you an exercise, but there's no substitute. You must assess the person, particularly if they're valuable goods, like a good athlete, and particularly if they are subjecting their body to something like gymnastics, where it requires a lot of expertise to build a gymnast rather than tear them down. And a chimpanzee can go and injure anybody, go do this exercise. And, but it takes a tremendous coach to take someone through to the Olympics without injury.
Right. Absolutely. It's many, many years and patience and work and, communication, things like that.
Absolutely. I think, how many car mechanics are there in the USA? I'll bet you there's tens of thousands of them, but how many can build a race car that can win Indy or F1 year after year after year? It's the same guys.
Yeah.
It's the same guys who are building Olympic gymnasts. It's the same guys who are getting guys in every sport. It is such an expertise, and unfortunately, those experts have no time for Facebook.
Dr. Google, right?
Well, that's it. It's fun.
Great. Yeah. So that helps contextualize it. So I guess shifting gears a little bit more towards now that we understand maybe the differences here and how to kind of maybe help somebody not have this problem or rebuild somebody back up after they've experienced this injury. I'm curious about, so from reading the recent book, but also a lot of books earlier, I started to see the value of maybe using, because traditional gymnastics, when I grew up coaching and as an athlete, was only body weight for pretty much everything. But after I read about end plate fractures, I read about the landing forces, I started to really take more what you had done is a lot of other people, my mentor, Mike Reinhold, had been doing with Eric Cressy and some of the people. And I started thinking about like, okay, maybe there's a blended approach here to help prepare somebody for these compression forces. So from my point of view, I've always found that proper landing mechanics is something that's super important in gymnastics. Unfortunately, we're a little bit behind the times in terms of the stress of the knee and the stress of the back. So trying to educate someone about how to, again, have that engram and land properly, but also, do you think there's value in maybe a bodyweight athlete, so to speak, doing something like a farmer's carry or sled pushes to try to build up maybe the sheer like loading tolerance to that exercise, or also just the engram of learning how to handle loads like that? What are your thoughts on maybe gymnasts doing a little bit of mixed modality training?
It's all of the above.
Yeah.
Well, it is. I mean, that's what it is. I mean, you mentioned some key words there. One is you're building resilience, and you're also building engrams. So when I talk to a coach and athlete, and I'll say, and by the way, people only come to me with back issues.
Right.
No one would come to me with anything else.
Yep.
So they're an athlete, they're coming to me with back issues, and I look at their current training because clearly they have pain, something's off.
Yeah, right.
And I'll say, what are your goals of your training? And if there's silence and they look at me rather oddly, I'll say, well, there's the problem. You need to train in a way to target specific goals, because everything is a trade-off. Think of an MMA athlete who say is in the octagon for 5 minutes. Some of them are naturally explosive. And so their whole game plan is to win in round one, to swarm the other opponent. But if they get into round 2 and round 3, they're getting really tired because they have an explosive metabolism. Well, what you'll find is in those athletes, they don't have a high VO2 max. They do not have endurance. That is a different metabolism. So when you have an endurance metabolism or a speed power metabolism, they fight one another.
Yeah, right.
Is this trade-off. So when I look at a gymnast, most gymnasts fall into the explosive strength power category.
Yep.
You're not out there for a 20-minute routine like on the soccer pitch.
Right.
So then I'll see some athletes and they're training and I'll say, well, why are you doing that? You are training your aerobic metabolism. You are sacrificing and losing on the trade-off what you need on the gymnastics floor for success. So that would be my first comment, to look at the program and write down on a piece of paper the purpose of every single exercise. And then I want to talk about the programming. Tell me about the days on versus the rest days. Tell me about your training cycles. When do you have a deload cycle to let all the adaptations of the tissues that you stimulated, we want them to gristle. We want them to cause bony calluses, whatever we're trying to achieve. So there's a little bit of a start on that. But again, as I said earlier, you have to know the biologic code. Where are the tipping points? Then you have to know the training side, how to stimulate appropriately, etc. But when we get into gymnastics specifically, I look at all of those exposures, as we call them, the demands of the sport. I look at the specific athlete's training, and then let's say they are getting a little bit tweaked or a little bit painful with a specific type of load. I'll then work with the coach and the athlete and say, well, what are you trying to achieve? Let's choose a different tool now. So let's say that it's a bending spine trigger. Maybe it's extension, maybe it's flexion, maybe it's both, but they have a resiliency when they're in neutral. I'll say, great, let's sit on the floor, create a kip. So if you can see my legs, they're straight out. I've got a kip pike going, and I'll now climb a rope with discipline. So there might be a brachiating, pulling kind of gymnastic training stimulus, and I'm not picking the scab of the pain trigger. We might do and I do this myself. If we go outside here in BackFit Pro, I have a dipping bar, and that could be like a parallel bar for a gymnast. And I'll just hang and do little leg swirls, just gymnastics 101, beginning gymnastics. But I will do that for just general health, because it has a gentle traction. It creates all the brachiating stability work that I need in my shoulders. And it's an attraction environment, but it's the engram. It's just keeping my brain fresh and dexterous for all of these kinds of things. So there's, I don't know if I've really answered your question, but just one thing that came into my mind as we were going through that. Let's say you've had an athlete now who's been back injured, and you want to know as a coach, can I reintegrate them now into a specific gymnastic move or a gymnastic apparatus, or, can I then go to the pommel horse or floor routine or whatever? There we use a 3-day cycle for testing. So say they've been off a gymnastics routine for a while. Just try 1 or 2 repetitions of it, or, maybe 20 seconds of exposure, and then don't do any more that day. And if there's no pain that first day, great. Second day, you now audit the athlete. How does your body feel? Does it feel just the same? Or it may even feel more stimulated. And they'll say, fabulous, I'm back on the bars again. I feel great. There's no pain. Great. Don't do any more. This is day 2, just an audit. Oh, but if they get a little bit of a sick or a tweaky feeling in their back, you just had your indicator. You need a bit more time to build the more robust foundation underneath it. So back off. But so day 2, let's say you get a green light, do no more training. Now we go to day 3. If you did a 20-second exposure, now go to a 40-second exposure. Don't just that.
Yep.
perfect form, good coaching, all of that.
Yep.
And then day 5, you audit once again, and you just repeat the process. So do you see it's a 3-day rolling cycle?
Yeah.
What that does is it allows you to explore where your current training capacity is.
Okay.
It also allows you as the coach and athlete not to really blow up things in a bad way, because, you know, if I get an athlete and they are acute attacks repeatedly,
yeah,
their training is off, their coach is just far too aggressive. Oh, you've had a good week, let's go back and do the routine, and they blow up again.
Yeah.
But this 3-day cycle is much more conserving, and it's a conservative approach. So say you did get a tweak. Okay, you just found your biological limit. Back off now and stay underneath and do the building. And what your job is to build capacity.
Right.
So now you know where the level. And if it happens to be a farmer's carry or something like that, that could be a substitute for that time being. Anyway, does that answer the question?
No, it absolutely does. Yeah. And I think you kind of definitely wrapped up well at the end there, is where maybe if somebody can't tolerate just basic gymnastics on the apparatus, equipment is very demanding, right? Just basic jumping and basic trampoline things and basic hanging is the basics of gymnastics are aggressive on a spine that's very sensitive or doesn't have a lot of loading tolerance. So, you know, again, based on the pathology they had, well, okay, if landing hurt you in the beginning, maybe a very light farmer's carry is a good halfway point between you got spiked in training and it hurt when you did jumping on floor, but you also are just not going to do anything. We got to dose you a little bit. So like a farmer's carry might build you back up slowly before you can try again down the road. Yeah,
that reminds me of a gymnast who was a trampoline gymnast, a very, very successful, but just perfect training form. And don't train when you're tired.
Yeah.
Don't allow those fatigued engrams to allow little mistakes that then go and pollute the perfect engram that the athlete is trying to express, whether it's on a trampoline or some other apparatus. I'm being a bit random on you here, but these are little tricks of the great ones.
Yeah. Yeah, it's great. And so I guess the last question that I had related to forces is, I think the most unique force in gymnastics are extreme traction forces, right? So hanging, when you watch men's high bar, they have these extreme aggressive taps that are like incredibly demanding. And also the rings, swinging through the bottom of the rings, but also women do release skills on bars where they tap very hard on the rail. And I find that in my own experience, this is what actually I had a pretty bad back injury with in high school, which has led me to become a physio. But a lot of athletes say they only get pain provoked with the bottom of that swing. And so I think, again, kind of covering topics we've talked about, is sometimes they lose their stiffness at the bottom of the swing, or they don't have good technique or coaching how to maintain stiffness on the apparatus. And it seems like gravity really puts in a huge shearing force on their spine. Can you talk on maybe what might be going on there, and what you think are good ways to kind of pick up on that?
Yes, well, I think you've answered the first part of the question yourself.
Yeah.
Maybe at the time of maximum traction load, they are failing to create controlling stiffness, which adds compression to the spinal joints. And if they have one with micro movements, that could be the trigger. But we would discover that through an assessment. But let's go back to the science. Any joint, in order to destabilize it, you put it into traction. You know, think of an MMA or just a martial arts arm bar.
Yeah.
You traction out the joint and then you lock it. But if the antidote to that is to suck the joint together, which is stabilizing. So traction is always destabilizing to a joint in a linkage. So with that particular background, here's my thought. I would be very, very surprised if a gymnast caused the injury in traction. I think they're well under the tipping point if they are intact and normal.
Right.
Somewhere they created a damage doing something else. So the discs are not ball and socket joints. They're actually collagen fibers.
Right.
Held together with a gooey ground substance, which creates a little bit of a seal for the nucleus behind them that gets pressurized. Those collagen fibers connect into the bone and the end plate of the vertebra with things called Sharpie's fibers. Okay. Those are most easily damaged in compression. So I would suspect that if we looked through, say, a micro high resolution CT, we would see a little bit of trabecular bone damage where the Sharpie's fibers are occurring, or on MRI, you might see a little bit of bone edema, which is the bone bruise, indicating the Sharpie's fibers have been compromised. But that's almost always, at least in my experience, a compression injury.
Right.
Then traction now becomes painful. So you've got an existing bone bruise. They go through the giant swings and some of the maneuvers that you've mentioned. Now the bone bruise becomes symptomatic. But again, if you see, these are all cascades.
Yeah, sure.
And if you know the cascades, my initial suspicion will be it was a compression injury first, but now can be triggered by traction. But there, assess, and an assessment always contains provoking the pain and then playing with different combinations to take the pain away and make them robust again. Right. So part of the assessment would be to say, well, I might have the athlete prone on a table, and then I grab their legs, and then I pull them in traction, and then I clear the knees, and then I give them a rattle. Yep. So there is traction with complete relaxation. Now I'll see if that triggers pain. So there might be a pain provocation. Then I might say they're laying prone on a table, turn your head a bit and press your eyebrow down on the table 5 pounds. And then they'll say, oh, that took my pain away. I just tricked them into creating an anterior chain stiffness.
Interesting.
And then you see, I've tricked them without coaching them to see, am I able to take away the pain? Or I will use more robust tricks to trick them into more stabilizing. But anyway, it will convert. I'd love to work with you on your athletes for a day or two.
Oh, totally. Absolutely.
Yeah. Why aren't you certified in the McGill method?
No, it's funny you mentioned that. I was going to take the whole 3-day course in Maine when it was here, but it fell on a competition weekend when our girls were so I had to be in 2 places at once.
Anyway, what a fabulous question. And that took us into several different concepts with cascades.
Well, thank you very much for explaining that. I think that really, definitely the Sharpie fibers point definitely makes sense. And speaking from the practical clinical side of me, I've seen, again, a lot of these athletes, especially at the higher end, who maybe just knowledge of the sport is lacking in the practitioner they see. And it is almost true that you always say, what was the first thing you remember that you got hurt with? And like, well, taking off the compression of floor or landing a very heavy dismount. And then I'm like, okay, well, then the next 2 weeks, what happens? I said, well, then it started to hurt when I swing, and then it started to hurt when I do certain movements. So usually if you can trace back to what was the first thing you remember that really gave you a big blow up, they'll say it was the compression forces.
That's certainly my experience, but now you know that.
Yeah.
Go back to the MRs and you'll look at them in a whole new light. What you'll be looking for are little edema pockets underneath the ring of the Sharpie's fibers. Or you might see a central end plate fracture.
Right.
And that might be, it'll give you a forum to interpret that a radiologist would never have, because they don't see the patient.
Yeah.
I never trust radiology written reports. I always have to see the images, and then only after I've seen the athlete and really done an assessment. Then I know what I'm looking for.
Yep. Yeah, absolutely. And I think that definitely the traction forces in the end plates transitions very well to my next question, which was, I mean, I've always been working in not pediatrics under 10, but 10 to 18 is mostly the athletes that I see, a lot of high school and college athletes and a lot of people into their young 20s. And I think that something I've always been curious to want to ask you is you see a ton of very mature adult athletes, 20, 30, 40-year-old professional athletes. And I see a lot of 10 to 14-year-olds struggling with back pain who are prepubescent, who are immature. And I think that a really unique injury that I have heard about and seen is a ring apophysis fracture, which is, again, very unique to an immature spine that has an open growth plate. So can you maybe speak to your experiences working with younger athletes, kids that are, early specialization athletes, dancers, ice skaters, things like that, versus maybe what's different on the fully mature athlete?
My mouth is falling open because you are Absolutely fabulous with your insights, and boy, you're highly skilled, Dave. You know a lot.
I
Yeah,
appreciate that.
yeah, you're very, very good. Well, with kids, several points come to mind, but I'll describe the points through stories if I can. The first one is kids are not mini adults.
Yeah, yeah.
Here's a typical scenario. A dad or mom will bring their child athlete, and I can think of several gymnastic athletes in this category. And then the parent will say to me, we have Olympic trials coming up next year, and we have to do this and whatnot. And that's a dead giveaway to me. Then I see, no, it's not we, it's actually your child. And then I'll say, and this is, don't we do pattern recognition? And we see the same things over and over again. So here's the pattern. And then I'll say to the athlete, tell me about your training. And they said, well, okay, we go to gym at 5 o'clock every morning. And Thursday afternoons, I have the sports psychologist. 3 days a week, I'm with a strength and conditioning coach. Then they have, some other person who helps them with a different aspect. And then I look at the kid and I'll say, when was your last day off?
Yeah.
And it's complete silence. And the parent has arranged, not in a nasty way. They're only trying to help their kid, but they've arranged everything, not realizing that a professional athlete would never train in such a way, but there was no one to monitor them. Because one coach is not knowing what the other coach is doing. And it just gets piled onto the kid. So my first response in summary is parent pressure. This is a real issue with, and I would say particularly gymnastics. It's in the culture. No kid becomes a great gymnast without a supportive parent.
Correct.
That's just the nature of it. The second general thought with the younger athlete is that your behavior all day long, so 24/7 behavior determines your training capacity. And I will see some young athletes who have terrific posture and movement all day long. They're really maximizing their training capacity. And I'll see the next athlete who's a really good athlete, got terrible habits. And then here's the typical young female gymnast. I call it peacocking. So chest proud, and they prance around like it's gymnastics 101. And then you'll see, sit on a chair, raise your chest, become a peacock. Oh yeah, there's my pain. And then I'll say, drop your chest, or I might use a technique from Okinawan karate. Take your arms, fill your lungs with air, make your lips pursed, very small hole, push all the air out. Now, did you see my chest come down into strength? And I created a very stable environment. Then I'll just say to the athlete, there, hold that. There is your position. And then I'll load them in compression. Do you have any pain? No. I'll load them in shear. Do you have any pain? No. So all day long, the peacock was picking away at the scab.
Right.
Or the next athlete who will come in, as soon as I put them in a gymnastic environment, their ears prick up and they are fabulous, beautiful movements. And then I noticed when they came in, when they took off their shoes, when they come in the door, they just were a floppy wet fish, and down they went. And then I'll purposefully, in a clandestine way, get them to pick up their pack sack. Or I'll say, would you check this on your phone with me? And I get them to look up something. And then right away, they just go right down into this kind of a posture. And then I test them in that posture. Guess what triggers their pain?
Sure.
So all day long, it was someone wasn't on their case. And they didn't realize that building training capacity comes from unloading the tissues that you're stressing in gymnastics. So they adapt to desensitize the other 23 hours of the day. This, Dave, has been a real game changer in some really good Olympians, believe it or not. So I can't stress that. And unfortunately, in physical therapy, I'm sure you're aware there are groups that say, oh, posture doesn't matter and that kind of thing. It matters enormously when you're trying to build pain-free training capacity, because these young athletes under huge stress.
Yeah. And that's very, very helpful. And this is just the way that it seems to be working out well, but it definitely leads to the next question I had, which is something I've thought a lot about since the beginning of reading your work, but then also more recently when you talked to Aaron about collagen adaptations in the, the actual discogenic around it itself. And so something that I study a lot in tendon research and then also in ligament research is how, like we've been talking about, a stimulus creates some sort of a change based on what is now becoming known as an epigenetic pathway. So the stress changes a little bit of the epigenetic translation of expression of genes or things like that. So in a bone, like we had talked about before, that bending stress is mechanotransductive, puts an output of more tissue that's stronger, right? In a tendon, that happens as well. And then I think that from what I've learned about this can happen in many other areas of the body. And I'm curious about how you think this applies to maybe the collagen fibers changing. Is this something that's, like we talked about before, I'm not going to be an NBA player because I wasn't blessed with long bones that can be 6'5", but maybe I was blessed with, more natural collagen mobility that allowed my, flexibility to be more. Is this something that you think that changes with training, that a young gymnast is naturally predisposed, and as they train more, the collagen fibers may adapt to become more mobile, versus if that person became a power lifter or a bodybuilder, they might get stiffer? Or is this just something that you think it is what it is, and there's no really way to change it, it's just what you're born with?
Another fabulous question. Good
Thank
job. I think you almost answered the question, so I'll just highlight a few things. We are all of a different genetic makeup. Mm-hmm. So in terms of your propensity to, or a predisposition to a certain disease, you also have a predisposition to tolerate specific types of loads. Mm-hmm. So genetics determines the anatomy, the collagen makeup, all of these kinds of things. Why does scoliosis tend to run in families? Why does hip dysplasia run in families, etc.? So genetics, you may have heard this expression, genetics loads the gun.
Yeah.
And then mechanostimulation can either trigger positive adaptation or negative adaptation. So I think you've hit the nail on the head. But in all of that, Dave, is natural selection. So if you took me, for example, I knew really young that I was a terrible gymnast. I wasn't a mobile athlete. So, I chose ice hockey and football and lifting and these kinds of things, just because natural selection allowed me. If you're terrible in gymnastics, you're going to go find something else. So, yeah, right. so that does a lot. Now, if you're in like a former Soviet system, you would have been tested and channeled into a sport. You are going to be tennis player. You are going to be weightlifter. And they were testing abilities that way. So those selections, whether it's natural in the American culture or coached in an Eastern Bloc, then that certainly is the way it goes. But now let's talk about mechanostimulation and adaptation. We talked about vertebral bone. Mm-hmm. That happens very, very slowly. And as we also know, there's windows. So a young female, the most potent time for bone adaptation in their whole life is when they're 14 and 15 and 16 years of age. Mom, stop driving your kids to school. Get them with a backpack, walk to school, train. Do you know what I mean? It's just crazy that they are robbing future health by driving their kids. What are they thinking? But anyway, enough on that. My kids had to walk to school. Anyway. So we talked about vertebra, but let's talk about discs. Well, historically, there are some studies, and they were done on coal miners in Wales. Mm-hmm. Earlier, a young male, say they were 16 or so, entered the coal mine, and coal mining, by the way, is picking away down in narrow spaces. In other words, you're flexed over. It's pretty tough work.
Yep.
Those who survive, not many of them, there's a survival rate there, but those who survive tend to have less disc herniations later in life.
Interesting.
So now, no one knows, could it be that the work adapted their collagen? That's a possibility.
Yep.
The possibility also exists that it's pure survivorship. The genes that allowed them to survive, there you go, that protected them as well. So we don't know. However, when we take the average person and we bend the spine over and over and over again, we've measured this. The collagen fibers, which run this way in one layer and this way on the next, if you keep bending them around, the ground substance, the gooey substance between the fibers loosens, which allows you to have even more spine mobility with less stress. Fabulous. But now when you compress a spine, you can see the nuclear gel down inside the disc there. You're squeezing that because it acts like an incompressible hydraulic fluid.
Right.
You get tremendous positive pressure in that. So when I squeeze it, and the collagen has been adapted to be soft and loose, the fibers are a bit loose, and then the nucleus can work its way through. Do you see my thumb coming through? Yep. It can work its way through delaminations that can occur. And we've measured those delaminations with thousands and thousands of cycles of movement. Now, this is in cadaver spines, of course. So again, if you're above the tipping point, they accumulate. If you're below the tipping point, you may get more ability for movement. But here's the rub. The more movement, the more laxity in the disc, the less ability you have to then bend and squeeze. So when you bend and squeeze, I'm just going to show if you can see that red collagen defect right there. Do you see the nucleus, the pressure pushing? Now I'm going to hold the spine in neutral. I'm going to squeeze it. Nothing comes out hydraulically because now the thrust line is straight down through the spine. So do you see that closes the nucleus? And that's exactly what you measure. You have the young athlete, they'll sit on a stool nice and upright. You ask them to pull up on the chair and they say, oh yeah, no pain. And then they slouch and you pull and they'll say, oh, my right toe just went numb. Okay, well, that's L5 on the right side. We just put pressure on that nerve root over a bit of time, and that replicated your symptoms. Then we go to the MRI and we see a fissure through the annulus, and the nucleus is now tracked through. So, we compare T2 to T1 weighted images. You can see if that's a plug now, it's old, or if it's fresh nucleus coming through. And then those are what we call dynamic disc bulges. They shrink and grow based on the posture. So if an athlete has that, I can mitigate it quite often simply through posture. Don't go into, so, we've got a player in the NHL who cannot tie his own skates. If he ties his own skates, he's set off that mechanism and it will disturb his play. So the trainer ties his skates and now you wouldn't know that he has a back issue. So these are all strategies. Once you know the mechanism, you can then mitigate them as a coach through technique and training strategy and that kind of thing. But anyway, to take the polar opposite of the argument, look at the power lifters. Quite often they walk around in Birkenstocks because they can't tie their shoes. So the price that they paid to acquire the ability to squat 1,000 pounds, stiffness. Healthy? Well, that's for you or someone else to argue. But the point is they have adapted their body to really have the ability to withstand load. So there's the spectrum. Now there's the athlete who's been touched by the hand of God who can have both. And I think of, a fabulous lifter like Chris Guffin who can pick up 1,000 pounds and he's got a bit of spine mobility, but you talk to him And
Yeah.
he will tell you he manages the exposure quite precisely. And he's actually on our website as someone who's been very successful at managing the exposure to have the, you know, the guy's in the Guinness Book of Records.
Yeah.
But you know, there's a very, very gifted person. One thought, do you remember a year or two ago, this went so-called viral on the internet. There was a coach in the US, a gymnastics coach, who was caught on one of the girls' cameras, and he had the girls straddled on the floor, and he was pushing their nose between their legs down to the floor, breaking their hip joints basically,
Yeah.
to create more mobility. And I think, I'm not sure if he was charged. I think he was charged. But anyway, I know there was a lawsuit afterwards. Well, not with that particular coach, but there was another coach who, and this isn't uncommon, doing this to another set of young female gymnasts. Well, I saw one of those athletes, and she came to me, and you know, the surgeon who saw her said, "Oh, there's nothing wrong with your back. We can't find the reason why you have back pain. It probably wasn't, you know, being forced nose down to the ground." You got to be kidding me. When I measured the pain triggers in her back, of course, this caused tremendous central bone pain. Then I went to her MRs. I could even pull them up here. On L5, she had a bone bruise on the anterior margin and a labral fracture. L4 fractured, L3 fractured, L2 fractured, L1 fractured. And the surgeon missed every single one of those that were clear to see if you looked for them. You just had to work at it a little bit.
Wow.
So, in other words, she was a heavily traumatized fractured spine on the anterior margin. And those are all, you know, flexion forced fractures of a young spine. And you were talking about the growth plate breaking. I mean, that's where these fractures were. So, you know, it broke my heart that she had been accused almost of the pain was, you know, something psychological and, you know, some kind of trauma, and treated that way. No, it was purely physical. And of course, her mistreatment caused a lot of psychological issues and damage.
Sure.
But it was the whole genesis of it was anyway. There's an example of they were trying to create an acute adaptation, which I just think is abusive.
Yeah. And it's really interesting to take away kind of the common threads of all of this, right? Is a lot of this comes down to specificity and dosage, right? There's that's a huge component of all what we're trying to do. And something that I found very interesting, and it wraps up this point well, leading into the next one actually, is, you know, I've studied a few different people's work and overlaid them to see if maybe there's patterns. And I don't know if you're familiar with Tim Gabbitt's work at all, but looking at workloads, right? So his research says that if you do too much too fast, or if you know, push somebody into overtraining, it's a U curve, right? It's a U curve of spiking on both sides. And it's similar to what your work, I think, has shown, is that we want to slowly develop that adaptation, but not push somebody too far into the overtraining curve. And that seems to be what happens with stress physiology in our body. Our body responds to that appropriate dosage of load specific to your goals, right? And I think that's where the bone, the collagen, the mechanisms of injury we're describing, it all comes down to something disturbing that equation of too much or not enough recovery. Would you agree?
Absolutely. This is where the power of science comes together. So Dr. Gabbitt and his work has reached a conclusion, which is the same conclusion we've reached, but we just took a different pathway to get there. We were more of a tissue specific, and he was more of a concept, but we both arrived at exactly the same place. So that's creating a more strong scientific foundation.
Yep, absolutely. And it goes down to the cellular mechanisms. Dr. Sapolsky's work says the same thing with stress physiology and the way our bodies respond at a micro level. So it's very interesting to hear about the different paths people take to get to the same conclusion.
Yeah, it's basically, if we could put this into coaches' language, a coach builds training capacity and then doesn't pass it.
Yep, absolutely.
In a nutshell, that's what the great coaches do. Build training capacity and then honor wherever that limit is, and you stay within the limit.
It's super interesting. I really love that takeaway. And I think it leads to my last question, because I'm conscious of your time. And the last question I want to ask is very selfishly to gymnastics specifically, is that, like we had maybe talked about before the interview, is the rates of lower back pain reported in the research are a gross underestimate, in my opinion, because knowing a gymnast, I never spoke up about my back pain. I had a stubborn mentality. I just wanted to train because that was my community. And I think that unfortunately we're seeing, just like ACL research is maybe showing we're not making a huge dent, I don't think we're making a really positive dent in lower back pain rates currently. And I think that something that's going to happen is we have to embrace a new idea to try to get a new solution, right? So I'm wondering if you think maybe there's a better balance between external loading and only body weight training that might help gymnasts build more resiliency and robustness to such high forces, or you think it's something, again, based on specificity, that we just need to be better about the loading cycles that we're doing?
Yeah, what a huge question. With every back pained athlete coming here, whether they're gymnastics or not, they have a pain for a reason. Mm-hmm. So I have to back off on the mechanism that causes their pain.
Yep.
The second bit to that is pain corrupts. So Vladimir Janda, who you may have heard of, the great Czechoslovakian neurologist, proposed ideas of things like chronic back pain and chronic hip pain causes facilitation of the psoas, so it becomes a bit tight. Now, he called it hip flexors, not psoas, but nonetheless. And he said, well, there seems to be some sort of inhibition of the gluteals, or they... in any case, I think we were the first to actually measure those things. And, you know, it's not in every back pain person, but it is in some, absolutely. So he would say, well, you stretch what is tight. Well, I would say you release some of the things that are facilitated. Yep. So to really target the psoas, there's several ways to do that. And I've measured his techniques to be really very, very good. Mm-hmm. And to try and then his words were strengthen that which is weak. Mm-hmm. But we didn't find the gluteals were weak. We found that the brain forgot to use them in the engrams. Sure. So the athlete became hamstring dominant. Well, that inhibits performance and injury resilience to the hip joint as well. So when we measured those things, it then took us to phase 2. There has to be some correctives because pain corrupts. So you may have to do some anatomical, mechanical correctives, but you also have to do neural correctives to get the brain to remember the gluteals and release the psoas. So that's my second comment on that. Now that you've dealt with the legacy of pain, rebuild their skeletal linkage. So here's a core principle of a mechanism of a linkage. Distal athleticism requires proximal stiffness. So I'm going to wiggle my finger very quickly. The faster I wiggle it, the more stiffness I had to give to my wrist. Otherwise, my wrist would become soft and compliant, and I would lose speed out of my finger. So if I wanted to push very quickly through the arm, I had to have more core stiffness. Otherwise, my body would collapse. Sure. So it's the law of a linkage that proximal stiffness unleashes distal athleticism. Yep. So, you know, I just think of these images in my mind of beautiful gymnastics technique. What gets scored a 10? They are control of the body, starting with the core and then getting the, say it's a floor routine. What makes beauty is control. Yep. So then rebuild the linkage to express that beautiful athleticism. Does everybody need more mobility? No, they need strategic mobility and stability. So phase 3 now we've removed the cause and dealt with the legacy of pain and perhaps tissue damage. We now tune the body is the expression that I use with strategic mobility, stability, appropriate endurance. So if we were talking about gymnasts, don't need much. And core work. no gymnast leaves here without more core work, because it will add that neural stiffness I was talking about to hold all the joints together, engineer out the micro movements. In other words, you're building training capacity just through more core work. That's about it.
Yeah.
And then when the career is done, I don't know if you want to talk about this, but there's a detuning that is required as well, because, you know, we talked earlier about the pattern recognition of different athletes. Mm-hmm. Isn't it interesting that when you take a group of Olympic sprinters and then you take a group of Olympic gymnasts, when their competition career is done, they're done.
Yeah.
You don't see the Olympic sprinters competing in masters games to sprint. You don't see the gymnasts doing it either. Yep. But you will see, like a baseball player, when they retire, they have a much greater chance of, oh, now they've transitioned into some other sport and they're having a lot of fun.
Yep.
But the gymnasts don't. Now, there are those who are children, and I think of one lady now who's very successful in powerlifting, who was a former gymnast.
Yeah.
Well, our work with her is to engineer out all of the adaptations she made as a gymnast to become stiffer and more load resilient now. So that's been the focus of her training. As she got better at that, she lifted more load and became much more competitive. But here's the thing. Bad athletes don't become gymnasts. It's not possible.
Yeah.
Great athletes are gymnasts, but they're tuned. So now as they transition to other sports, they really have to retune their bodies.
Sure. Yeah. Specificity, right?
Yes, but gymnastics is one of those extremes, I would say.
Yes, absolutely. Yeah. And it's two things popped into my mind as you were kind of walking through the examples. I think I remember a paper by Paul Hodges where they actually injected some sort of pain provocation into someone's back and had them do a step down test. And they had a very interesting finding where the redistribution of muscle activity within the spine and then also within individual muscles started to, it's a short-term adaptation, right, to that pain trigger. And I think I often tell people, I give a metaphorical limp of your back sometimes. You're moving a little bit differently because you're trying to deload that sensitive tissue. And I think it's what happens in the glutes and then the psoas, as you mentioned, I think also has been documented in the spine. And it's working through those phases of trying to get somebody back, right?
Well, of course, and knee pain, you know, I think that was the start. The principle is called neurogenic inhibition.
Yeah,
so
sure.
if you have pain, the brain strategically diminishes neural drive to certain parts. So VMO and knee pain was quite well documented, but no one had ever documented hip and back pain on the gluteals. I think we were the first to document that. And certainly, you know, there's a spectrum of response. In some people, it's a very strong inhibition, and in others, it's almost non-existent. But for those who it is strong, you have to deal with it. So, yeah, for sure, we limp. And here, you know, we've done several studies on coaching expertise. The more the coach coaches correctives on muscle sequencing and cueing muscle and that kind of thing, the greater the transference from the corrective exercise to the real world. So we did studies on stretching, for example. So we would measure a person doing things in real life, and then we would change them from say a 5 percentile of hip mobility to a 75%, tremendously effective hip mobility training session over 3 months.
Yep.
Do you think that changed how they moved in real life?
Probably not unless they were taught.
Bingo.
Yeah.
So just to change the mobility through a stretching program, as far as we could measure, did nothing to the way they moved. They moved because of their engram, which was the character of movement. So good coaching changes engrams. You know, I'm going to stand on one leg, I'm going to do a hip airplane, and the person's knee falls into valgus. And you might see that landing on a high bar dismount, for example. But then to coach, take your hip and push my knee into my hand now while you're standing through your hip.
Yeah.
that is the kind of coaching that then translates. So that's an external cue with an auditory cue, and then practice. And you said earlier that we haven't been that successful with ACL injury, but that would have been very specifically a strategy that someone like Tim Hewitt might use in female basketball. And he's been probably the most successful intervention program that I know of, where he's brought ACL injury rates in women playing NCAA basketball, which we know, I believe, is 6 times the rate of men. And he's brought them right down, for those that he trained with that good coaching, into injury rates on par with men. So I would say that's a very successful example of changing engrams and behavior through good coaching to mitigate the risk of a very specific kind of injury. Yeah.
And I think that's a really good kind of place to wrap it all up together, right? Good coaching and synthesizing the data and understanding the unique demands of what you're dealing with are very, very important for long-term success. Absolutely. And I think that covers most of what I was hoping to ask you about. And before I kind of give you the opportunity to say where to find you, I think that people that are looking to a more in-depth explanation of a lot of these things, it's kind of it's a lot in an hour-long podcast. So BackFit Pro probably has all of your books that are available and some research studies, correct?
Yes. Well, my books are on backfitpro.com. They're also on the various Amazons in the world. But on BackFit Pro, we have some other resources, some articles, other podcasts, and things like that. I try and keep the content high. And I don't even know how to sign on to Facebook or those things, but my daughter, apparently we have a Facebook page.
It's for the better, I'm sure.
Well, my instructions to her are try and keep it, announcing where our various courses are and new sorts of things, and keep it fairly rich in content. I won't be there in my bathing suit doing one of these things like that.
That's great.
Not that anyone would be interested either, I'm sure.
Well, as someone who does still consume the content and regularly practices trying to read the newest stuff, I appreciate all that you do, and I think that people would be very, very interested in trying to find more of the books and things like that, because it's definitely helped me a lot in terms of the foundational sciences, but also, again, that's where kind of the innovative thoughts have come from, is synthesizing pieces of the work that's been done and trying to apply it, as needed.
Yes. Yeah. Well, if anyone has back pain, if I can just finish up with this very important concept. Getting rid of pain requires a very targeted effort. That's why I wrote the book Back Mechanic. It takes the person through a self-assessment and shows them what not to do and to do. So that's to get out of pain. Then they can morph their training to enhance performance, or try and recuperate some of their former performance. And there are some athletes, we have 3 responses with every athlete that we see. They have no response in terms of regaining their career. And some people, that's just the way it is. Others will come back and they'll regain their performance and set a new world record. So that they've used the gift of injury to clean up their training, and lo and behold, they even surpassed it. And there are those who they fail. That they've had such a substantial compromise of their load bearing and body that these are the things that happen. However, we do have a pretty good record of getting them out of pain. So that next book is Ultimate Back Fitness and Performance. So they would then go to ship. But anyway, that's so Dave, I've got to say this, your knowledge of the scientific code, but also the art of coaching is phenomenal. So good for you.
Thank you. I really appreciate that. I've had a lot of people to learn from, and I also have a lot of good mentors as well. So I'm just standing on the shoulders of giants, as Tim Gabbett said in our interview.
Yeah, fabulous.
Well, thank you so much. I'm sure you will see me once my schedule dies down. I'm definitely going to plan in some time to get to the courses. So if you're there, I'll be there.
Okay. I'll look forward to meeting you then.
All right. Well, thank you very much for your time, and I really appreciate it.
Thanks, Dave.